1 out of 6 people with diabetes in the U.S. ration their insulin to save money. We don't believe people should have to choose between food, rent, and their insulin. Civica was formed, and our mission is to make medications available and affordable for all. We're a non-stock, non-profit, and we were formed to address the patient issue of shortages with injectable generic medications.
Some companies, it's not affordable for them or profitable enough for them to make the medications anymore, or the volume just isn't there. So what we do is we pool together the volumes and we try to source these medications that previously haven't been able to be sourced before.
To solve drug shortages doesn't happen overnight. We broke ground at this facility in February of 2021, and we had to have partnerships with companies like Groninger and SKAN to make it happen.
In my 20 years of pharmaceuticals, Groninger and SKAN were both companies that I'd worked with in the past, and both companies that I wanted to see as part of this project.
We co-developed this machine concept to make an integrated solution of a vial filling machine with an isolator that is one-sided, has all the greatest technology integrated.
For this Civica project, we have one vial filling line and one nest filling line. Gives the customer the flexibility to run different sizes, different formats on the parts, and it also gives them the advantage in the future.
To have this on the North American soil, that's the big thing. We can have all these components here, we can bring in our machines here, and we can have the best products made on North American soil.
SKAN and Groninger have been working together for years and years and years, and we both realize the importance of the North American market, and we communicate and collaborate constantly.
SKAN and Groninger, we're all in it for the same mission, so having that collaborative environment with a well-intended purpose behind it has been great.
The more you recognize that what you're doing from day to day really affects the patient, the better you perform, just naturally, instinctively.
Diabetes is an autoimmune disease that you can get no matter what. It can happen to anyone, anytime, anywhere. There's nothing you can really do to stop it.
We've had great insurance the entire time, and it still costs a significant amount out of pocket. The people who need these medicines don't choose to need them. It is just something that happens to them. And so having the peace of mind to be able to know that there's a company out there not trying to get rich off of their misfortune is amazing. Insulin is important to families who have diabetics in the family, but when you look at what they're doing the same thing across the board for all of these other drugs that they're looking at producing. The idea that Groninger and SKAN are jumping onto this really makes it more of a movement.
As someone who's had diabetes for his entire life, I would just like to say thank you to everyone who's helped with this project.
It really makes me proud to know that we're providing quality, affordable medicines for people when they need it.
I'm proud to be part of a company that is putting the patient first.
Everybody knew why we were doing this, so as a team, with this team spirit, you can overcome any challenges in the project, and that was really what made this project special.
What better and how more gratitude can you get working for a company when you know at the end of the day you're actually part of saving somebody's life?
I'm really proud to say Civica's already delivered over 140 million doses of medications that have benefited over 60 million patients already. And now we built this manufacturing plant, and we can go even further.